Our next speaker is Dr. Fred Wigley, and while I have the stage, I'd like to give a little case report here. What happened to my slide? Oh, okay. So this is a short case report, Weather, CCR, and Fred Wigley. Dr. Fred Wigley was invited to speak at CCR ROB. ROB is the Rheumatology on the Beach, our old name, in 2004. A few days prior to the meeting, there was a weather event, Hurricane Ivan. And we were right there, or we would have been right there. We never made it. The bridge washed out, I-10. So then, Dr. Wigley spoke in 2005. There were no weather events reported. Then he was invited to 2014. There was a weather event, as you all know, torrential flooding. So the conclusions of this case report, the sample size is small, p-value just fails to meet statistical significance, and if Dr. Fred Wigley is on the program, pack an umbrella, raincoat, and waders. And Fred's going to talk to us about vascular treat to target, possible strategy in scleroderma.
I was wondering why I got that message to go home in my room. Well, we talked this morning about the complexity of the biology of scleroderma vascular disease, and now I would like to talk about the practical issues of managing the vascular disease and perhaps some novel thoughts about what we should be doing in order to reverse this awful disease process. My disclosures again. So what can we do about the vascular disease? Well, first there's the vasospasm, and we tend to use vasodilators, and that's just about the main approach that most of us do. But what do we do about the vasculopathy that we saw on our previous lecture? Are there protective agents that can be helpful? Is immunosuppression helpful? Should we be using stem cells to help the stem cells that are not effective in vivo? And then there's this ischemia reperfusion injury that we often ignore. Should we be using antioxidants and enhanced nitric oxide in these patients? And then there's this coagulation occlusion, and should we be more aggressive with inhibiting platelets or anticoagulation? So let's see if we can address some of these things. Well, the first thing is the vasoreaction that you're also familiar with, and these are some slides of the pallor that occurs in Raynaud's, this dusky cyanosis. In scleroderma, the thumb is often involved. If the thumb's not involved, then it's often a patient with primary Raynaud's. And oftentimes you can see even extension into the palm of the hand, suggesting larger vessel disease. The Raynaud's is triggered by abnormality of vascular reactivity to the environment and stress. And that is primarily mediated through these vessels we call thermoregulatory blood vessels that are AV shunts that are so rich in the skin, particularly in the areas, as I pointed out earlier, where we have most of the fibrosis. But and these run in parallel with the nutritional capillaries. These AV shunts are designed primarily to regulate our body temperature. And the way that they work is on this cartoon is that when there is a cold environment, these shunts will contract and make the blood stay in the deeper plexus. And when there's warmth, the sympathetic tone will decrease, and there'll be this rush of blood to the surface, which can be huge and make a big difference in terms of flow to the skin. These thermoregulatory vessels are under sympathetic control. And so one of the first things this is a slide, by the way, of these AV shunts in the skin. And what's interesting is that the studies have shown that these shunts line up with the fingerprints and just go particularly on the globular skin, which does not have any hair follicles, or they're particularly dense and thick in that area. The other thing that's interesting is that these blood vessels have 3 alpha receptors, alpha 1, which is the prazosin target, but there's also the family of alpha 2, alpha 2A and alpha 2C. The alpha 2